Synopsis. 12-year-old male patient has arrived at Lutheran General Hospital emergency room accompanied by both parents with signs of an acute asthma attack. He weighs 38 kilograms and has a full code status. Patient has been having difficulty breathing since the early a.m. Patient has taken albuterol 7 times in the past 7 hours with no help. Patient presents with shortness of breath, lethargy, weakness, and cyanosis of the lips. Patient has a history of asthma, seizures, and ADHD. The patient's medications include Concerta, albuterol, Singulair, Symbicort, valproic acid, and ethosuximide. Patient has seasonal allergies to ragweed, dust, and mold. The patient has been in the ER 3 times in the last 9 months for asthma-related issues. The parents are present and have a calm but concerned effect.
Hey, Liza.
Hi.
There's a new admit in room 12, William Smith.
Do you know what it's about? Why he's here?
He came in for an acute asthma exacerbation.
Okay.
So if you can go see him when you get a chance.
Sure. Hi, Liam. My name is Liza. I'm going to be your nurse today. Hi, Mom. Hi, Dad.
Hi, I'm Lily.
Hi, I'm Lily. Nice to meet you.
And I'm Lisa. I'll be your patient care technician today, and I'm going to start off by taking your vital signs, okay? So I'm going to ask that you put your game down just for 1 minute.
All right, let me.
Thank you.
And Liam, while Lisa's getting the blood pressure cuff on, can you please tell me your name and your date of birth?
Liam Smith.
And can,
10/26/99.
and can you spell your last name for me?
SMITH.
So, Liam, what is it that brought you into the ER today?
I wasn't feeling good. I have a cold.
He's had a cold for about 2 days and said his medications aren't working. He's been wheezing all morning.
Liam, I see that you're having some trouble breathing. Can I apply some oxygen for you?
Okay.
Beep. Okay, Liza, so I got his vital signs. I'm going to go check on our other patient. Is there anything you need me to do?
No, I'm over now.
Okay, thank you.
Liam, here's some oxygen, okay? Just a little bit to help you breathe a little bit easier. Okay, Liam, I'm going to listen to your heart and lungs, okay? Sorry. Is that okay?
Liza notices the patient is restless, shaking, agitated, and having difficulty breathing, and has cyanosis of the lips.
Here. Can you sit up for me? Take a deep breath in. And again. And again. And again. Can you squeeze my hands for me? Wow, you're a strong little man. And you just have to do this little on your oxygen.
Oh.
So, what medications is he taking at home?
Liam takes albuterol, Singulair, and Symbicort, and he takes Concerta 40 milligrams a day for his ADHD, and he takes valproic acid 250 milligrams at night, and ethosuximide 2 caplets a day for his history of seizures. Here's a list for you.
Thank you. So, Liam, what were you doing before you started having trouble breathing?
I took my albuterol every hour, 2 puffs.
And do you remember what time you took your albuterol?
I was watching iCarly. I think like 8.
And I'm sorry again, how many puffs of albuterol did you say that you inhaled?
2 puffs every hour.
2 puffs every hour? That seems like a lot, isn't it?
Yeah, he's supposed to take 2 to 4 puffs every 4 to 6 hours.
Yeah, but when I was here, they gave me every hour and I felt better. I didn't want to miss my baseball game tonight.
Sorry. You know better. Okay, well, we're gonna, because with his history of seizures and with the amount of albuterol that he has taken, we're gonna put him on seizure precautions, just to be on the safe side. Okay. Lisa? Hi, this is Liza. Can you please bring me the seizure precaution equipment for Liam in bed 12? Thank you.
I'm sorry, wait, does he need to have seizure precautions if he's on seizure medication? Shouldn't that control it?
We're putting him with the amount of albuterol that he has ingested. It's an over amount. It's way too much. So a side effect of taking too much albuterol is the chance of him having seizures. It has nothing to do with his history of his seizures. So we just want to be on the safe side, and we're gonna make sure that we're gonna put some pillows around the bed in case a seizure does arise.
Hi, it's me again. I have the equipment for the seizures.
Sorry, we're
Okay.
just really concerned.
Okay, Liam, so we're just gonna put these here, okay?
I'm gonna put one over here. Liam, how are you feeling? You're doing okay? How's your breathing? Is the oxygen helping you? How about on a scale out of 1 out of 10? How would you rate your pain? Are you having any pain? Okay. Liam, do you have any questions for me? You feeling okay? Mom and Dad, do you guys have any questions?
All right.
I don't think so.
Alright, I'm gonna go call the physician to give him a little history of what's going on with Liam and see what kind of orders, if any, he wants me
Okay.
to do.
If you could just keep us updated, that'd be great.
Okay, sure, great.
SVAR. This is the technique Liza will use to explain the patient's situation to the doctor.
Hi, Dr. Bones.
Hi, Liza. How are you?
I'm doing well. How are you?
Good, thank you.
I just would like to give you some information on a patient I've been taking care of. It's a 12-year-old little boy. His
Okay.
name is Liam. He presented to the emergency room with an exacerbation of an asthma attack. He's been having difficulty breathing since early this morning. He hadn't been feeling well, so he took it upon himself to take some albuterol. He took actually 7 puffs of albuterol in the last 7 hours.
7 in the last 7 hours.
7 in the last 7 hours.
Okay.
His parents are now present with him, in the room with him. He did present with a shortness of breath. He was a little lethargic, weakness, and he had a cyanosis in his lips. His current vital signs: blood pressure 130/80. His temperature is 97.9. His respirations are 38. His heart rate is 130, and his oxygenation is 88%. I did put him on 4 liters of oxygen, and at this time, his breathing seemed a little less labored.
Okay.
What would you like to do at this time?
Why don't we go in there together and I'll give a quick assessment and then we'll go from there. Okay.
Come in.
Hi, Liam. I'm with Dr. Bones.
Hi. Hi, Liam. How are you? I'm Dr. Bones.
I'm the
Lily.
ER doctor. I'm sorry, I just washed my hands.
okay, Lloyd,
Nice
yeah.
to meet you.
Hi, Liam. How are you?
Liam, can you please tell me your name and your date of birth?
Liam Smith, 10/26/99.
How's your breathing?
Okay.
You doing okay?
Okay, Liam. You want to talk to me and tell me what happened? What made you take 7 doses of albuterol in 7 hours?
Well, last time I was here and I wasn't feeling good, that's what the doctor gave me. Kept giving me more med every hour. So I thought if I did it at home, I could stay home and not miss my baseball game tonight.
Okay, I understand. Well, I'm just going to listen to your lungs right away, okay?
Mm-hmm.
All right. Take a nice deep breath. Again. Okay. Okay, one more. Can you sit up for me? Thank you. Okay. All right. Okay. All right. Okay.
And I'm just gonna put these back on your finger because it's kind of important for us to measure your oxygenation, okay?
Okay. Well, we have some standing orders here. So we're going to have his peak expiratory flow rate done. Going to get a chest x-ray, CBC. We're going to get an EKG done. I would like you, Liza, if you could please get some normal saline in here. We're going to do 75 milliliters an hour.
Okay.
Okay. We're going to get respiratory therapy up here. We're going to give him a nebulizing treatment, and we're going to get some prednisone, and we'll keep checking on him, and we're going to see how things go, okay?
Okay. And what about his MPO status? Would you?
We're going to keep that in mind. Thanks, I'm sorry. Do you guys have any questions before we?
Will he be going home today?
You know what? We have to see how things go. I think I would like to keep him here overnight just for observation, okay? All right. Liam, do you have any questions for me?
No.
Okay, well, we'll be back in a little bit, all right? Okay.
Thank you, doctor.
Thank you, guys.
Dr. Bones, I would just like to reiterate your medication orders that you have for Liam. It's correct that respiratory therapy is going to come down and give him nebulizer treatment of albuterol 2.5 milligrams per 3 mLs.
Yes.
Okay, and then with this prednisone, is it correct that we are going to give 1 milligram per kilogram twice a day?
Yes, let me figure that out for you right now. Okay, so it's going to end up being 19 milligrams twice a day.
Okay, great.
Okay?
Thank you.
All right.
Nebulizer treatment. Teaching. The nebulizer treatment will be administered in a comfortable area and is expected to take 10 to 15 minutes to complete. The compressor will be plugged in and the medication vials emptied into the nebulizer. A mask will be assembled and placed on the patient while they are sitting in an upright position. Once the compressor is turned on, the patient should be instructed to take slow, deep breaths. If possible, the patient should hold their breath for 10 seconds before slowly exhaling. This process is continued until the medication chamber is empty. Nursing priorities. Assess lung sounds, pulse, and blood pressure before administration and during peak of medication. Note amount, color, and character of sputum. Observe for wheezing. If condition occurs, withhold medication and notify a healthcare professional immediately. Albuterol. Teaching. Instruct the patient to take as directed. If a dose is missed, take it as soon as possible and space remaining doses at regular intervals. Do not double doses or exceed recommended dosing. Instruct patient to notify healthcare professional if shortness of breath is not relieved by medication and is accompanied by nervousness, dizziness, palpitations, or chest pain. Advise patients to use albuterol first if taking other inhalants and wait 5 minutes before taking other medications. Nursing priorities. Assess lung sounds, pulse, and blood pressure before administration and during the peak of the medication. Note amount, color, and character of sputum. Observe for wheezing. If condition occurs, withhold medication and notify a healthcare professional immediately.
Liam, I have your prednisone here that the doctor had prescribed for you. It's 19 milligrams, okay? And what the prednisone does is it helps with the inflammation of your airways, okay? It helps the swelling go down, okay? Liam, can you please tell me your name and your date of birth?
It's Liam Smith and it's 10/26/99.
And how do you spell your last name?
SMITH.
Great, thank you. Has the radiology been by to take your chest x-ray?
Yeah, they did the chest x-ray, they came in to draw some blood, and the respiratory also came in to do the nebulizer treatment.
And Liam, since you have had your nebulizer treatment, how do you feel?
I feel like I can breathe a little bit better since the treatment.
Do you have any questions for me?
No.
Okay. The doctor will be right into in a little bit with your results, okay, from your chest x-ray and the blood work that we have taken. Okay?
Prednisone. Teaching. Instruct patient on correct technique of medication administration. Take missed doses as soon as remembered unless it is almost time for the next dose. Do not double doses. Stopping suddenly can result in adrenal insufficiency. Review side effects of corticosteroids with patients. Nursing priorities. Assess for signs of adrenal insufficiency, which are hypotension, weight loss, weakness, nausea, vomiting, anorexia, lethargy, confusion, and restlessness. Monitor intake and output ratios and daily weights. monitor serum electrolytes and glucose levels.
Hi guys. Remember me? I'm Dr. Bones. I'm the pediatric pulmonologist. Okay. Oh, someone's not happy. Okay, just so that you know, the chest x-ray came back, it was clear. Your EKG was normal, but your expiratory peak flow rate was a little bit lower than we like to see. So we're going to keep you overnight. We're going to keep an eye on you. I'm sorry, I know you're going to miss your baseball game, Liam, but you know what? If you were to go to your game tonight, you wouldn't feel good anyways. Okay? So the next one you'll be ready for, you'll be all better, and we're not going to do 7 doses of albuterol in 7 hours anymore, right?
Right.
Perfect. Okay, do you guys have any questions for me before I go?
I don't think so.
No? No. Okay. Well, if you need anything, I'm going to be here for a little bit longer, okay? And if there's anything we can do, just let us know, okay?
Can he eat?
No, we're not going to have him eat anything, okay? We're going to still keep him NPO, which is nothing by mouth, okay? All right. We'll see you guys later.
Hi, Liam. How you feeling?
Oh, better.
You're doing a little better?
Yeah.
I'm sorry you have to miss your baseball game.
No.
But you know what? It's better off you're in here and being on the baseball field than something worse happening to you, right? So now that you understand that you're not supposed to take 7 albuterol treatments in 7 hours, right?
Yeah.
And Dr. Bones came and talked with you, and he told you his plan of care, that we're gonna keep you overnight for a little bit of an observation, okay?
He's really hungry, so how soon can he eat?
Well, once we get you to the floor, you'll be able to probably have some soft liquid, like maybe some fruit juice or popsicle, something like that, okay? Once we just situate up to the floor, probably an hour or so, okay? I'm going to call the nurse who's going to be taking care of you on the second floor, on the pediatric floor, okay? And once I give her report, we'll get you transferred to the floor. Do you have any questions for me?
What room is he going into?
I'm not sure. I just know it's the second floor. They haven't given me a direct room yet. Okay. Hi, Jen. This is Liza. Are you taking care of Liam, who's going to be coming from the ER? Okay. He's a 12-year-old little boy who arrived to the ER this morning with an exacerbation of an asthma attack. He had taken 7 albuterol treatments in 7 hours. The patient has had a cold the last 2 days. He's alert and orientated ×3. He's accompanied by both of his parents. His current vital signs are blood pressure 124/70, heart rate 80, respiratory rate 18, temperature 97.9. His oxygenation is 98%. His lung sounds auscultated to clear bilaterally. No numbness or tingling. No complaints of pain. He has a left peripheral 16 gauge IV with normal saline running at 75 milliliters per hour, and which we placed at 5 o'clock this afternoon. The patient has seasonal allergies. The patient has received 1 nebulizer treatment per respiratory therapy and has been given 1 dose of prednisone 19 milligrams orally. Patient is responding to the medication well. Patient has stated that his breathing has been less labored. He has a history of asthma since he was 6 years old. His current asthma medications are albuterol 2 puffs every 4 to 6 hours, PRN, singular 1 chewable tablet per day, and Symbicort 1 puff twice a day. He has a history of petit mal seizures, which is well controlled with valproic acid and erythrosumaxide since the age of 3. His last dose was last night at 9 p.m. The patient is placed on seizure precautions due to the overdose of the albuterol and of his history of seizures. The patient also has a history of ADHD since the age of 9, which is also well controlled with medication, Concentra 40 milligrams per day. The last dose of that medication was given at 8 a.m. this morning. Prior to discharge, the patient and parent teaching needs need to be done, and regarding their knowledge and a return demonstration on how to administer the albuterol treatment. Any more questions? Okay, thank you. And what bed will he be going to? 212? Great, thank you.